Hi, my name is John Osgood, and I'm John Osgood Neuromuscular Therapy at Jabz Gym. We're here today to talk about a misconception about stretching when you have lower back pain from sitting for long periods of time. What happens is when you sit down, you have a muscle that comes from your spine to the inside of your leg. It's called the psoas muscle, and that muscle shortens in this position. So when you get up from here, it's tight and it pulls you forward into an anterior pelvic tilt, and that makes your back curve more. So you feel a lot of pressure in your lumbar spine. Now, the misconception is that if you stand and bend forward, this will release the pressure. Well, it will for a second while you're down here, because again, it's shortening the muscle up more, and it's taking the pressure off your back because it's shortened and there's no pressure holding the back arch. But if you really want to get some relief, the way to do it is to stretch the psoas muscle. If you're at work and you don't have a massage therapist to help you, an easy way to do it is to take two chairs. You basically take any two chairs that are pretty much stable. I wouldn't use a roll-away chair at the beginning, although you can when you get better at it. You'd stand in front, put your foot up on the seat of the chair, gently take the one that you're holding on to stabilize yourself, and to drop down gently until you start feeling pressure here and a stretch here. Now when you get good at this, you can edge out a little bit farther and drop down farther into it. You'll notice after you do this after a while that you'll feel a relief in here, and that your muscle and your pelvis is going to be able to be a little bit less locked up. You can do this every hour, every couple hours, or whenever you feel like you need to stretch. It's okay to combine this with hamstring stretches. Keep your back straight and drop down and not roll your back. Hamstring stretch here, opening up your hamstrings and your glute, and coming up, and then initiating the psoas stretch right afterwards. Dropping down, stretching, holding it 3 to 5 seconds, and then coming back up. Switching. And then repeating until you start feeling that you're getting some relief. So I hope this has been helpful for you.
So can I ask you a question real quick?
Absolutely.
So you're saying that the front of your hip, what muscle was that?
The psoas muscle.
So that is actually what's causing some lower back pain, because when you're sitting all day, you're kind of crunching it up, right?
Well, it shortens. So when I'm standing here like this, the muscle might be this long, and when I sit down with my knee coming up, it might shorten to here. So if it stays like that for too long, it's going to want to stay like that. It's going to shorten up, and it's going to, after months of sitting at a desk job, you're going to have something what they call disuse atrophy happening. Atrophying muscle, something that the muscle that is not functioning correctly because it's not being used enough. So what we're going to do is we're going to try and stretch that muscle out to make it more functional and to not lock up your back. And one of the ways to do that is to do the stretch I just showed you.
Great. Well, thanks so much, Oz.
Until next week.
All right, see you, Oz.